Are you a fellow endo babe on your trying to conceive journey with endometriosis? Are you new to trying to conceive, or have you been through the ringer, whether that's through multiple rounds of IVF, failed IUIs, years of trying to conceive, or heartbreaking losses? Whether you're new to the journey or have been on the journey for many months or years, this video is for you. Welcome back to the Endo and Fertility Space channel. In today's video, we are talking about fertility red flags that your doctor might have missed. I hope this video provides some new insights and maybe even some direction on what to do next. If you haven't already, please give this video a like, share it with a friend, and hit that subscribe button so you don't miss any of our endo and fertility specific content. So the first thing we're going to do is deep dive a few lab marker red flags. I'll then share a little bit about some red flag symptoms it's not wise to ignore. And then I'll be sharing some tips along the way. So the first lab marker red flag I want to talk about is elevated eosinophils. Eosinophils are common immune cells that your doctor will check for on a CBC with differential. This is a pretty standard lab. This is a test that deep dives your white blood cells. Eosinophils mostly elevate in response to allergic reactions or parasitic infections. Allergic reactions stimulate mast cells to release histamine and other inflammatory chemicals. High histamine stimulates estrogen production, and high estrogen can in turn negatively affect cycle length, ovulation, and contribute to the worsening of endometriosis, fibroids, and cysts. High histamine can also reduce the quality of cervical mucus and contribute further to the immune dysfunction that already exists with endometriosis, and it can affect implantation. You can have your eosinophils tested. The number should not fall above 3%. Some signs or symptoms of high histamine corresponding with elevated eosinophils include migraines or headaches, congestion, itchy skin, itchy eyes, hives, rashes, nausea, flushing, or a heightened environmental sensitivity. To help manage the symptoms of high histamine, consider taking a DAO enzyme. You can do anywhere from 1 to 6 capsules a day. I like Seeking Health Histamine Block as a product to keep your eyes peeled for. Symptom management might also include quercetin, alpha-lipoic acid, PEA, and vitamin C, as these are great mast cell stabilizing supplements. Nettle tea can also help dampen symptoms. I encourage you to consider an IgE food or environmental allergy panel to try and identify what your allergens are. If you have constipation, consider deep diving your gut or testing for small intestinal bacterial overgrowth. And or if you suspect estrogen dominance, then work on estrogen elimination through increasing your cruciferous vegetable intake in the diet, increasing your omega-3 intake, or alternatively considering a supplemental good quality omega-3 supplement. Diversify the plant foods in your diet, or consider an estrogen-specific supplement like Indole-3 Carbinol, Vitex, a B-complex, calcium D-glucarate, or DIM. Several parasitic infections can also complicate fertility. Trichomoniasis vaginalis may cause deformities of the genital tract and tubal inflammation. Toxoplasma gondii can cause endometritis, impaired follicle development, and ovarian uterine atrophy. Trypanosoma cruzi impairs implantation and placental development, and Entamoeba histolica can cause pelvic pain and genital ulcers. If you have suspicions that a parasitic infection may apply, consider having a vaginal swab completed or talk to your doctor about other specialty testing that can rule this out. The next red flag marker is a collection of markers that indicate general inflammation. So this includes elevated CA-125, CRP, or ESR, and in general, these indicate that there's inflammation in the body. Some literature even shows that a positive CA-125 over 30 only corresponds with a false positive endo diagnosis 8% of the time. A positive CA-125 also correlates with infertility in endometriosis patients. Inflammation is a well-recognized barrier to fertility with endometriosis, so when these markers elevate, it's an indication of a very inflammatory state. Inflammation can affect egg quality, implantation, fertilization, and embryo development. Systemic inflammation, for which CRP and ESR are markers, is a known factor in implantation failure and poor fertility outcomes. If you have a CA-125 marker over 35, an ESR over 10, and or a CA-19-9 over 14, it's time for you to start trying to identify what other sources of inflammation may be compounding on top of inflammation from endo. Consider testing your liver enzymes, fasting insulin and glucose, vitamin D, and iron status to start. And speaking of insulin, insulin resistance measured by a fasting insulin over 8 or over 55 in Canadian units, can impair ovulation and promote inflammation. This is a huge red flag that is commonly brushed off, but improving blood sugars and insulin can support huge positive shifts in fertility outcomes. Hormones can also play a big role in inflammation, so consider having your DHEA sulfate, testosterone, progesterone, estradiol, and prolactin checked. Your numbers should fall within these ranges. So for DHEA sulfate between 92 and 219, for testosterone between 0.6 and 1.8 or 17.5 to 43.5. Progesterone should be over 18.5 7 days after ovulation or 58 in nanomoles per liter. Prolactin should fall under 10 micrograms per liter, and estradiol should be between 145 and 300 pg per ml. Commit to reducing systemic inflammation through an anti-inflammatory Mediterranean style diet, improving your gut health, and staying consistent with the unsexy basics, including exercise, sleep, stress management, and blood sugar balance. The next red flag marker to investigate is your luteal phase progesterone and estradiol. It's common for women with endometriosis to experience luteal phase defects. Naprotechnology Science has identified 5 luteal phase defects. The first is a short luteal phase length under 10 days. So that's the period of time from ovulation to the start of your next period. The second luteal phase defect is low pre-ovulatory estrogen. The third luteal phase defect is luteal phase progesterone that is slow to rise. The fourth luteal phase defect is rapidly declining luteal phase progesterone. So the luteal phase, again, is that phase from ovulation just before the start of your next period. And the fifth is rapidly declining luteal phase estradiol. Your luteal phase is the window after ovulation, but before the start of your period, as we've established. It's a critical phase for implantation. Here's what I recommend tracking. Progesterone and estradiol at 7, 9, and 11 days post-ovulation. Progesterone should rise after ovulation and stay steady to support implantation. If it drops too early, it can trigger early spotting or a short luteal phase that makes it difficult to sustain a pregnancy. Progesterone helps to reduce inflammation in the endometrium. When compounded on top of progesterone resistance, suboptimal or rapidly declining progesterone levels can be very problematic. Estradiol is essential for building the uterine lining. A lining of under 8 millimeters or over 14 millimeters could complicate or prevent implantation. Outside of the luteal phase window, estradiol should reach at least 200 pg per ml at ovulation. Estradiol triggers LH, which triggers ovulation. Lower levels of estradiol can signify poor follicle development and maturation, meaning the eggs produced will likely be of lower quality. Your cervical mucus production is also reliant on healthy estrogen levels. Cervical mucus is your sperm superhighway, an essential piece to the fertility puzzle. Abnormally low or high levels can also contribute to suboptimal cervical mucus production. Signs your progesterone may be suboptimal include spotting 3 or more days before the start of your period, anxiety or mood shifts or sleep issues leading into your period, or a luteal phase length under 10 days. Signs your estrogen may be abnormal include tail end brown bleeding at the end of your period, infertility, low libido and low mood, or long stretches of wet cervical mucus. A continuous wet without lubrication pattern could indicate a low-grade infection of the cervix. In 18 patients with this pattern, 15 had positive cultures, and when treated, the continuous wet pattern went away. For your next steps, have your peak plus 7, 9, and 11 progesterone and estradiol checked, or consider completing a Dutch cycle mapping test. Either is accessible through me in my high-level coaching options. If your estrogen levels are low, consider blood flow promoting foods and activities like acupuncture, beetroot-based juices, heat packs or castor oil pack application, and seed cycling. If your progesterone levels are low, have your cholesterol levels tested, especially your HDL. Make sure you're not under eating or overexercising. Build at least one stress management strategy into your daily lifestyle. Sleep well, and consider progesterone boosting supplements like Vitex, B6 in the P5P form, or food form vitamin C. If your peak estradiol isn't getting high enough, consider all of the above recommendations, but also have yourself assessed for LUFS, luteinizing unruptured follicle syndrome, and parasitic infections, and speak with your fertility specialist about ovulation-inducing medications like letrozole or peak estradiol HRT, hormone replacement therapy. Systemic enzyme therapy could also be helpful, and definitely reach out to a fertility massage expert to help with blood flow and organ mobility. The last fertility red flag lab marker I want to discuss in this video is thyroid. Many doctors only look at TSH, thyroid stimulating hormone, and maybe T4, but they miss TPO antibodies and thyroglobulin antibodies. Your thyroid controls not just metabolism, but also ovulation, hormone production, and menstrual cycle stability. The granulosa cells within your ovaries heavily rely on free T3 thyroid hormone as well to help you produce good quality eggs and to ovulate. But even if your TSH, free T3, and free T4 are normal, your antibodies can still be elevated. And this is a red flag because elevated thyroid antibodies are associated with a higher risk of miscarriage, impaired egg quality, and ovarian function and implantation challenges via increased uterine inflammation. Your TPO and thyroglobulin antibodies should be as close to zero as possible. If you are somebody with elevated thyroglobulin or thyroid peroxidase antibodies, these are some of my top tips. The first is to try going gluten-free. There is some literature that gluten proteins create confusion within the immune response, causing your body to attack the thyroid gland mistakenly. The second tip is to try Ovasitol, black cumin seed oil, vitamin D, and or selenium supplementation. My third tip is to use a red light therapy lamp over your thyroid gland 3 times per week for about 10 minutes a session. Studies show that this can reduce thyroid antibodies and normalize T4 and T3 ratios. My fourth tip is to keep your blood sugar stable. Blood sugar dysregulation is a huge driver of thyroid autoimmunity. Okay, the next red flag I want to talk about is ignoring signs of cervical inflammation. You can have your cervix looked at via routine assessment in office with your doctor. However, there are certain cervical mucus patterns that might also give you some insight into whether this is something that needs to be investigated in the first place. If your cervical mucus stretches a 1/4 inch or 1/2 to 3/4 inch, or has a gummy consistency that doesn't stretch or rebound, it just kind of squishes, like imagine a gummy bear, during the early pre-peak phase. So this includes 6 days before ovulation. This is one pattern that can indicate cervical inflammation. The second criteria is any discharge that stretches from a 1/4 to over an inch or is gummy in consistency, observed specifically from 4 days post-ovulation. If the cervical mucus is stretching over 2 inches, this is one criteria for peak type cervical mucus, and we shouldn't be seeing peak type cervical mucus well after ovulation has already occurred. Because cervical inflammation is likely caused by an infection, BV, candida, ureaplasma, mechanical irritation, or physical trauma, or endometriosis, it's definitely an important first step to see your doctor in case you need to be treated with antibiotics. Besides this, consider vaginal probiotics, boric acid, or apple cider vinegar baths to help reduce the pH in the vaginal microbiome. This can help reduce inflammation at the level of the cervix. The next red flag I want to talk about is ignoring BV or recurring yeast infections. The vaginal microbiome is an often overlooked area where you have a lot of control when it comes to improving fertility outcomes. Literature to date does show that a lactobacillus dominant flora, especially Lactobacillus crispidus, does have a central role to play in fertility outcomes, both with natural conception and assisted reproductive technology. Research also shows that Lactobacillus inners was underrepresented in cases of unknown infertility, and Lactobacillus crispidus was more abundant in patients with positive fertility outcomes. The endometrial microbiome is also relevant for fertility outcomes. Lactobacillus dominant flora in the uterine microbiome, similar to the vaginal microbiome, was associated with better fertility outcomes. In this particular review, a lack of Lactobacillus dominant flora was considered an emerging cause of implantation failure and or pregnancy loss. Additionally, in another study on Japanese women, the authors believed that the endometrial microbiome might be related to unexplained recurrent implantation failure. If you have ever taken an antibiotic, experienced funky smells or vaginal discharge, or you experience insufferable itching, these may be some signs that your vaginal microbiome needs supporting. Now, anecdotally, I have done vaginal microbiome testing with clients who have had absolutely no symptoms and still ended up testing for a rather dysbiotic vaginal microbiome. Lactobacillus strains, especially Lactobacillus crispidus, gasseri, and ginseni, are especially protective against inflammatory species, infections, yeast overgrowth, and BV. But like I mentioned, an abundance of these strains, which you can help to support with vaginal probiotics and changing the pH of the vaginal microbiome using things like boric acid, can help you achieve the vaginal microbiome that is tied to positive fertility outcomes and live births. Just one last thing to note here, chronic vaginal infections may present in subtle elevations in white blood cells that your doctor might not be placing an emphasis on, so keep your eyes peeled on your CBC and look for any consistently elevated patterns above 7.5. My favorite probiotics to correct imbalances here include the seed Lactobacillus crispidus strain vaginal probiotic, the Good Clean Love vaginal probiotic, and the Vagibiome pre and probiotic blend. If you suspect an imbalance in your endometrial microbiome, you can help support support this microbiome through vaginal or oral probiotics as well, and or by treating an existing infection. Lastly, to wrap up this video, I wanted to highlight a few red flag symptoms beyond the ones already mentioned in this video. If you consistently feel symptoms of your immune system ramping up around potential implantation, this could be a sign of an overactive immune response. So think specifically of things like a low-grade fever, body aches, a general feeling of malaise, itchy skin, itchy eyes, or congestion. If you have painful ovulation, this could be an indication of endo nearby, the presence of an endometrioma, hormone abnormalities, or high inflammation. Very light bleeding might indicate anovulatory cycles or very low estrogen levels, which might not be optimal enough to support good egg quality or implantation. Recurring losses or implantation failure is a big red flag, of course. You should be investigated for immune or clotting disorders. And one of my all-time favorite resources to learn a little bit more about some of these immune or clotting disorders is the book, Is Your Body Baby Friendly? Post-exercise or post-coital bleeding could indicate cervical inflammation, endometritis, or recurring vaginal infections. But keep in mind, endometritis is often completely asymptomatic. So if you have infertility or recurring losses and nobody's really been able to give you an explanation, it might be time to have endometritis ruled out. High histamine symptoms, as previously discussed, could be a subtle indication of an active or overactive immune response. Because sperm is foreign to the female body and a very slight shift in your immune response has to occur around implantation, if your immune system is overactive, it can prevent sperm and egg from meeting, and it could also be the cause for recurring implantation failure. Extreme fatigue, brain fog, and forgetfulness can be a sign of nutrient gaps, stealth infections, or thyroid concerns, which are all very important things to address with infertility or subfertility. Pressure or chronic pain in the pelvis can be an indication of a hydrosalpinx, endo, or even nervous system involvement in your symptom picture, i.e. central sensitization. Okay, so what's the takeaway? You deserve a thorough root cause approach to your fertility, especially with endometriosis. If your doctor or fertility expert won't explore these important areas with you, consider seeking out somebody who will. Drop any questions below and be sure to get on the list to be the first to know when the Endo Fertility Formula Challenge launches in August. You'll find that link in the show notes below. This is a fertility-focused challenge designed especially for you to identify what is at the root of your infertility or subfertility. If you found this video helpful, hit that like button, subscribe, and I'll see you in the next video.